Hi, I'm Dr. Amy Carter, and I'm the medical director of AesthetiCare. The great thing about AesthetiCare is we have all the newest, latest, and greatest technology, and so we have lots of different procedures to offer people. We take pride in making sure that all of our nurses and nurse practitioners and that myself, that we're all trained. I think the great thing about AesthetiCare here is we like to help people be their most beautiful self inside and out.
Hi, my name is Amanda. I'm a nurse practitioner at AC Wellness, and my passion is gut health as well as longevity medicine, and I can't wait to meet you.
My name is Kristen Davis. I'm a nurse practitioner at AesthetiCare Medspa and Wellness. I work at the Kansas City location, and I look forward to meeting with you.
I've been coming to this practice for, I believe, about 2.5 years now. I work in the health industry. I have a father that's a physician. I have a sister that's a physician. And health and wellness has just always been very important to me. When I was in my early to mid 40s, I noticed weight gain. I wasn't sleeping, didn't feel good, didn't recognize how I looked. Every visit I've had here has been 30 minutes plus because they really go through everything with you, getting the blood work done, starting you on treatment, and then you have a follow-up pretty quickly thereafter just to check on how are you feeling, are you sleeping, have you noticed any side effects, etc. You just get a really good feeling when you come in here, and it's like the team-based approach, and you know that your clinician's really rooting for you and wanting you to feel good and look good and have the energy that you should have.
Better health starts here. Get up to 25% off supplements at AesthetiCare. Pick out your favorites or from one of our pre-made supplement bundles. On a GLP-1, this bundle supports muscle, gut health, hydration, and cellular energy so your body stays nourished while you're on your weight loss journey. New to supplements, this trio covers your foundations, daily nutrients, omega-3s, and gut support. Everything you need to get started all in one. Struggling to unwind or stay asleep? Our sleep bundle supports relaxation, calms the nervous system, and helps you fall and stay asleep naturally. This kit is all about healing your gut, supporting digestion, balancing your microbiome, and restoring your system from the inside out. Healthy skin starts within. This bundle supports hydration, nutrients, and overall wellness to help your skin glow from the inside out.
Hi, everyone. I'm Kristen Davis,
Hi, I'm Amanda Pierce.
and welcome.
All right, we're going to start answering your questions here. First one, what weight loss management programs do you offer? Kristen, I'm going to let you take this one.
Okay. Well, initially you start with actually a phone screen. They'll call you, ask you about 5 or 6 questions, and then they'll get you scheduled for a weight loss consultation. So that's a pretty in-depth consultation. A lot of times we'll have you go get blood work prior versus waiting until you have the appointment. But we go over your history, your family history, your weight history, just a lot of the history, your exercise, your eating habits. And then we either send you for blood work or kind of go over the different options we have here. We do offer a lot of the GLP-1s, semaglutide and tirzepatide, which are the generic form of Wegovy and Zepbound. Those are the most popular, but we'll send you for blood work. We'll have you come back and do a lab review and depending on what your symptoms are, making sure everything's optimized. And if you qualify, there's no contraindications, especially with the GLP-1s, then we'll go ahead and get you started. Prior to doing that, we do what we call an InBody. So it's a body composition test where it measures your body fat mass, your skeletal muscle mass. It shows us your hydration status and also the visceral fat. So the visceral fat is the fat that lays in between the organs is dangerous and as we get older. So we always have a baseline with that. We don't necessarily promote any diet. Our program is all lifestyle modification to make sure that, what we are changing is sustainable and it's going to last through the lifetime. And then typically we bring you back every 4 weeks. I call them my gentle reminder appointments, but we focus in on nutrition. Are we kind of eating a wide variety of foods? Are we getting all the protein in? Are we eating our fiber? And we kind of touch base every four weeks or so.
This one here, you might want to go ahead and, the what do we use for body composition? Because
the machine we use is called an InBody, I think. Does that answer the question?
Yeah, I think so. And then there was a question about gut health here. I was going to grab that one.
I'll just piggyback off the InBody. So the InBody is a very quick test. You get weighed. There's some prompts where it has you hold handle a certain way. And honestly, I'm not quite sure how the machine works, but it pops out some magical numbers. So in less than, I don't know, a couple minutes.
Yeah. It sends a frequency, I believe, through your body, your barefoot. And then it's going to assess your skeletal muscle mass, your visceral fat, like you talked about.
It measures a lot in a couple minutes.
Couple minutes, yeah.
And we tend to trend that. If somebody starts off baseline, they have pretty good muscle mass, maybe every 2 to 3 months. But if somebody's starting out and their muscle mass is low, we really want to watch that. We don't want people to lose muscle. That's not,
Absolutely. Yeah.
Let's see.
I was going to grab that
Which
gut
one?
health question there. When you mentioned gut health in the video, how do you assess and address this? So certainly I'm going to take all your symptoms into account. And a lot of times gut issues can manifest in other ways, like skin issues in particular. So I'm going to take all your symptoms into account, and then we can take one of two paths. One, I could make recommendations to help heal a leaky gut, just kind of me guessing that that's probably what's going on. And the gut restoration protocol bundle that's on sale right now is typically what I recommend. And then if you feel like, no, I really want to know exactly what's going on with my gut, then I would say it's called a gut zoomer, and it's a stool test that you mail off. I get the results, and then we'll go over that. It's a 30-page report. So it checks, so many different markers, 7 different inflammation markers. It checks you for parasites, viruses, SIBO, bile acids. I mean, it's just pages and pages of information. And then I'm going to tailor a protocol for you at that point that's going to address the issues that came back on the report. So
let's see. Okay, so there's one question here. It says, what options do you have for someone that has had breast cancer and cannot do HRT for menopause? So depending on what type of breast cancer, if it was not hormone driven, again, this is a full consultation, significant, go over medical history, family history, lifestyle. But if it wasn't a hormone driven breast cancer, then you absolutely are a candidate for hormone therapy. And we do have women that have had breast cancer that was not hormone driven on hormone therapy. Now, those that have had hormone therapy, we do offer other options for symptoms. Everybody across the board is a candidate for vaginal estradiol, and that can help reduce urinary tract infections. It can help with vaginal dryness.
Yeah, and there's a couple medications they can use too for hot
Oh,
flashes.
absolutely.
Yeah,
Yes.
as well.
That are not hormone therapy, but yes.
And for libido and
Yes,
things like that.
absolutely.
Okay, what one do we want to do next? This one? Okay. What therapies do you recommend for longevity? That's a bit of a loaded question. The first thing I would want to do, and we all work a little bit differently. We all have our strengths and weaknesses as far as wellness goes, but particularly what I would do is probably a very extended lab panel. And I would want to know where your nutrient levels are, check for inflammation markers, things like that, and a more extensive probably lipid panel too, and then tailor the protocol according to your symptoms and your lab results. So it's, yeah, very person to person with that.
Okay, there's a question. Are the GLPs you prescribe compounded, or are they straight from the original manufacturer? So the ones we offer are from a compounding pharmacy. Both the semaglutide and the tirzepatide, both are compounded with B12, which is it's a water-soluble vitamin. So what your body doesn't need, you will excrete. But yes, and with the compounding pharmacy, they do what we call third-party testing. They do batch testing. We've never had an issue with the compounding pharmacy that we utilize. I've been here over 2.5 years, and we've used the same one. So,
and I'll tag on to that and say I like that we use
I
compounded.
do too.
Because you can slide in between doses if needed. Because some people, 2.5 to 5 is a big jump for a lot of people. They can get nausea with the 5 milligrams with that jump. So we can kind of slide between doses for you, as well as offer microdosing.
Yes,
too.
microdosing is offered as well. So there was a. Oops. Okay, so
Copper peptides.
I mean,
Okay.
yeah.
I've been hearing a lot about copper peptides. Any plans to offer that at AC? Yes. So we already have a topical, which is really great, by Omni. So that's fantastic for skin. And if you're under, I would say under like 30, topical is more studied than the injectable anyways for skin. And then I do believe we are going to be offering an injectable copper peptide and a sublingual as well soon. So
yeah, copper, good for skin, hair,
skin, hair,
wound healing,
it's anti-inflammatory,
gut health. So
they call it like a beauty peptide.
yes. And then I'm guessing whether peptides goes along with maybe the copper peptide, or there's a lot of talk about peptides. So we are in the works on offering 4 or 5 of those.
There's ones for like inflammation, healing, immune system, anxiety. There's several that were growth hormone stimulating ones to help with muscle. So we're in the process of that as well. So yeah.
Ooh, got one. Oh, okay, here we go. So there's a question. It says, I have a consult scheduled for an overall wellness assessment. It is $199. How do I get the 100 off? I think they're going to text at the end regarding that. Oh, and it needs to be booked by this Friday.
So yeah, just call us back and rebook it.
Oh, okay.
And we'll get you the $99. Can we use insurance? Did you answer that?
Oh, I didn't see that.
She said, can we use insurance? You can use HSA.
You can use HSA. Any blood work that we send you with, it can be run through insurance. We also offer a cash pay. We have a contract with LabCorp, so there's that option if you don't want to run it through insurance. Okay, and then supplement advice, activity advice, toning and firming, and GLPs for inflammation. And then, yes, labs possibly covered by insurance. So as far as activity advice, I think we all kind of advise around about the same. We're pretty big on preserving that muscle mass. So making sure people are doing their weight and strength training. The goal is 3 to 4 times a week. And there is a sweet spot. So we want you to lift enough to fatigue that muscle, but without injury. So heavy weights, less reps, fatigue, and then never working the same body group 2 days in a row. Cardiovascular health is running, brisk walking is great for the heart, the brain. So absolutely, that's part of our recommendation. And then GLPs for inflammation. So that would be, it's used off label. It would be considered, a lot of people will get decrease in inflammation. This is just a reaction they're getting from the GLPs. So a lot of times we'll microdose. So microdosing is anything less than the starting dose for weight loss. And so it's more based off how you feel. So if somebody, feels less inflammation on a 2 milligram every 10 days, then that's your microdose, versus maybe somebody needs a lower dose and they can extend it out a little bit longer.
I'll grab those too about the, yeah, they kind of tie together. Someone said, tell us more about the gut health bundle. And another person said, if you have SIBO and other GI issues and many tests recently, would the GI supplement bundle group be the best to start? So the gut health bundle consists of 3 products from Microbiome Labs. I really like this company. They do a lot of testing on their products to make sure they do what they say they do. So that bundle includes a spore-based probiotic. Spore-based probiotics, how I explain them is they're like little commanders. They survive your stomach acid, they survive antibiotic use, they get down to the gut, and then they tell the bad bugs to die and the good bugs to grow. Got it right here. And then it comes with a couple other products. They're both powders that you would mix in water, and you can mix them together. That's fine. One is Mega Pre. It's a prebiotic. Prebiotics, they are like fertilizer for the good bugs. And then it comes with Mega Mucosa, hence the name mucosa, that it's going to help repair the mucosal lining of the gut. It contains immunoglobulins, and they're like little Pac-Man, and they gobble up the bad stuff. And then it contains some amino acids as well that help repair the gut lining. So as far as like, if you have had SIBO, these are great products, and I would certainly recommend them for SIBO, but there would be some other products that I would recommend specifically for killing SIBO bugs. But I think my hypothesis is that probably 70 to 80% of the population has leaky gut. So that gut bundle is a great place to start, just to see if you can get what you need from that as far as your gut healing. And they say to use it for 3 full months for the gut to heal. So I would give it a shot and see if that alone would work for you.
Okay, there's a question about entering perimenopause, having erratic, heavy periods, used to be predictable and light in the past, not sleeping well. Yeah, that's perimenopause. Welcome. So again, a consultation, during perimenopause, it's very symptom based. Sounds like you are lacking in some progesterone. But yeah, definitely a consultation. Everybody's symptoms vary. There's such a wide range, but I always tell my patients, it's not just hot flashes and night sweats. And that usually comes later anyway. There's so many other symptoms that are associated with perimenopause. So if you're even questioning that you're in it, you probably are. And yeah, we'd love to talk about it. So. Oh, okay. I think you hit on this. So no, we're not offering the peptides quite yet. There is a question about the BPC 157 or the copper peptide, and those are 2 of the, I think, 5 that were.
Well, we have BPC oral actually.
Oh,
right
yes,
now.
yes. Okay.
That we have right now.
That's
for
right,
sale, but injectable, not yet. Considering it.
But close. Yeah.
Mm-hmm.
Okay, so do you need to be a certain weight to use a GLP-1? It's like the famous question. It's used off label if your BMI is less than 30. I have an issue with the BMI. It's just height and weight. So it's super outdated. That's why we like to do the InBody to really look at percentage of body fat, skeletal muscle mass. So an individual can have high muscle mass, low body fat, and be considered overweight. And then the vice versa. Somebody can have very low skeletal muscle mass, have high percentage of body fat, and be a normal BMI. So yes, we do use it off label. And then
Tesamorelin also on the list. It is
Mhm.
FDA approved for visceral fat, but it can be used off label for muscle. So yeah, it's coming down the pipes.
Okay, so somebody is getting their Zepbound covered, but loves the B12. So ours are our tirzepatide is compounded with B12, and the question is, can I get B12 injections? Absolutely. You can get a B12 intramuscular injection. We also offer glutathione injections.
Vitamin D.
Vitamin D.
We'd like to see your labs for that one though.
Yes.
Yeah.
What are some of the treatments for perimenopause? Again, it's pretty individualized. A lot of times during perimenopause, I prefer to kind of stack the hormones. So start with one and see if that kind of helps minimize a lot of the symptoms. And then as it's not, then we'll add. There's a role for progesterone, testosterone, estrogen, all in perimenopause.
And I'll tag onto that and say, usually the first hormone to go is progesterone.
Hence the sleeping issues.
Right,
Yeah.
right. So that will typically be one of the first ones. And then estrogen's pretty erratic. So we would want to see labs and see how you're feeling. Testosterone, certainly another option for energy and libido. We get your levels a little bit higher, typically what we call physiological levels with that to help with the energy and libido during perimenopause.
Yeah.
So.
And testosterone is a hormone that women produce. Don't quote me on it, but I think around age 30 is when we start to kind of dwindle down.
Mm-hmm.
So unfortunately, it's not approved. FDA testosterone for women is not approved at this moment, but so we use it off label.
And I guess we could talk about the different
Routes.
routes of application. Testosterone we offer, well, you talk about the pellets. And
so pellets are offered here at AC Wellness. It's a small procedure. You can do estradiol or testosterone in your pellets, but it gets placed in the upper buttock area. It's a small procedure. You get numb. That's all you feel. And they tend to last anywhere from 3 to 4 months for individuals.
it's one of our preferred methods because it keeps you very steady.
It's
a slow release.
Mm-hmm.
And then we also have testosterone injections you could do once weekly. You can do testosterone cream or troches through a compounding pharmacy. And then estrogen, we have, you can do a patch through a local pharmacy. There's creams, there's all kinds of options for that. And then progesterone's always in an oral pill form. I would say, yeah, I mean, I think she could go ahead and book. I think. So this lady here is interested in injectable peptides. Could I still book the January special to get in to talk to you to be considered a candidate? That's fine because we'd want to run labs on you anyways and just kind of see where you're at, make sure you're healthy, make sure you don't have any contraindications and all that. So.
I think did we get them all answered?
There's somebody that asked about the Thorne.
Oh, there's
vitamins.
Thorne.
Yeah. Wondering about the bioavailability of the Thorne supplements. How are they better than other brands? So I would say they're a practitioner grade brand. So there are practitioner grade, and then there are what you get at Walgreens and in Walmart and all that. So the practitioner grade brands, they send their products through third-party testing and they test their batches to make sure it's quality. And that's why the price point is usually higher on practitioner grade supplements. So Thorne's a great company, and there's other great companies too that we carry. We carry Designs for Health and Microbiome Labs, and so these are all, we only carry provider grade brands. So these are not the cheap synthetic stuff from Amazon.
I know.
you
I was, so to piggyback off of that, even
Mhm.
the Amazon, so you can buy, and I love Amazon, but you can buy like Thorne products or Designs for Health on Amazon. But you never know if the
There's a lot of fakes.
yes, yeah. So I think one of the reps had told us previously that they spent, I don't know, maybe $10,000 and bought their products off of Amazon and tested it. And I think there was a small fraction that actually had what was supposed to be in it. So
Mhm.
just be cautious buying it from Amazon.
There's
Where?
one question that
At the
says,
top.
Mhm.
Oh. Do you,
Yeah, well, Erin Miles, who is amazing, she's not here with us today, but she will be at the South location offering wellness services. She's fantastic.
and then when is that? April,
I think
May?
around April.
April
Yeah. So you
is-
can always see her here first. So you
Absolutely.
can get that 99, and then you could just follow her to the South location once that opens.
Okay, and then here's just a nice reminder that we're extending the January wellness consultation offer of 99 if you call the office by the end of the day tomorrow and book your appointment.
I think it's actually Friday, right? Or is tomorrow
Oh,
Friday?
It's Friday. Today's Wednesday. Yeah,
Yeah,
by
so by the
Friday.
end of the day, this Friday, book your appointment. Thank you, guys.
All right, thank you.